My name is Linda Staples, and I'm from Columbus, Indiana. I'm married and I have 3 children, 8 grandchildren, 1 great-grandchild. I've had AFib for a long, long time, many years. I would be lightheaded and dizzy. I slept all the time. I would get out of the bed after sleeping 8 hours and go to the couch and sleep. Yeah, I thought I was going to die.
My name is Mark Erdish. I practice at Franciscan St. Francis Heart Center in Indianapolis, where I'm the Chief of Cardiovascular and Thoracic Surgery. I've been in practice for a little over 20 years. Valve pathology generally is a mechanical problem, and fixing that mechanical problem makes people better. That was what attracted me the most, really, was something that we could actually fully impact and fully reverse. Atrial fibrillation is commonly referred to as an irregular heart rhythm, and it is common, in fact. Most people either know someone who's had it or they may even had it themselves. The most common type of heart disease with which atrial fibrillation is associated is valve disease. The typical causes of atrial fibrillation, which include hypertension and sleep apnea and obesity and diabetes, all of those things seem to be related to atrial fibrillation. Patients with heart disease, especially valve disease, also have additional stress on the upper chambers of the heart, and the changes in the characteristics of the muscle itself then lend itself to atrial fibrillation.
There wasn't a good quality of life before surgery. Nobody knows what kind of life that is. It's like not having a life.
So this irregular heart rhythm, atrial fibrillation, is chaotic electrical activity in the upper chambers of the heart. Instead of the usual synchronized movement of the upper chambers of the heart, where the upper chambers contribute to the cardiac output, where they contribute to the blood flow through the heart, instead of that, the upper chambers are just doing this. They're just kind of shivering. And people often say it looks like a bag of worms when you look at the surface of the atria. Now, some people won't really notice it right away. Sometimes it's kind of a more quiet process where they think, oh, I'm just getting a little older, or maybe I put a couple of pounds on and so I feel a little less strong or easily fatigued or even short of breath. And other people, when they go into atrial fibrillation, it's a sudden change for them. And with that, they lose some of their cardiac output and they become short of breath, they become weak, they become easily fatigued.
I didn't know I had valve problems until I came up here.
Well, Linda's an interesting case. She had been in atrial fibrillation for quite a long time. Her heart rate had been elevated and her left ventricle, the chamber of her heart, had become extremely weak. It was only squeezing about 1/3 of normal, actually less than 1/3 of normal. So now the heart muscle is weak, the heart's enlarged, the valves are leaking, and the patient has long-standing persistent atrial fibrillation with very large atria. That's a difficult scenario to treat effectively because we have to be perfect with everything. The valves have to be perfect. The maze operation has to be perfect. It has to be perfectly executed. This is such a ubiquitous condition. It's found at so many levels throughout cardiovascular medicine. And as we become more educated, as we recognize the things that are going to promote atrial fibrillation or decrease its incidence, from our end, from the heart surgeon end, we're going to see an increase in the treatment of atrial fibrillation when people are having heart surgery. Because right now we're not doing a great job of that.
One of the doctors said that they could do nothing for me except a heart transplant. But I still had faith. And Dr. Gerdish came in and said, I'm going to try to save your life, and he did.
Linda did wonderfully. So Linda, after her surgery, and Linda has a great mental attitude as well. You know, she was up for the game in the beginning and came out of it wonderfully. She's gone on to be very active after her surgery, and her muscle recovered. Then when we reverse that arrhythmia, eliminate the high rate, fix the valves so the valves aren't leaking and the heart's no longer volume overloaded, then we do see often, as was the case for Linda, we see that muscle recover.
After surgery, my life is more fulfilling. I can do just about anything I want to do. I have a better quality of life. It's normal. It's absolutely normal. So this summer I like to work in my yard. I have flowers, and I can do that this year. Because when I came up here, I didn't think I'd ever see my home again. If I can help one person go through what I've already been through, everything I went through is worth it.
So I really believe that if a patient has valve disease and atrial fibrillation, they should be seeking out full information about the disorder, the atrial fibrillation. They should be well educated about the opportunity to eliminate it. When a patient has both atrial fibrillation and valve disease, I think it's crucial that they become well educated about the disorder, about both disorders, and that they understand what the opportunities are to eliminate the atrial fibrillation when their valve disease is being addressed.
If I were to give advice to a patient needing heart surgery, I would say, come and see Dr. Gerdish, number one. Number two, don't put it off. If you start having problems with your heart, go see a specialist. Go see somebody that knows what to do.